So tell us first about what you do already. The
Sure.
medical group.
So Louisiana Medical Group, we are a weight loss clinic that specializes in GLP-1 medications. Many people know them as semaglutide and tirzepatide. And, we really got into it when there was a very high need. Unfortunately, it's a very expensive drug. And they, about 2.5 years ago, they came out with a coupon where you could get the drug for like $25.
I remember that.
It was the name brand drug. And then the coupon went away, and no one could afford the $1,500 cost of these medications. Insurance didn't cover it any longer for weight loss, only for diabetics. And we found a need and opportunity to help the public and go out and open up where we had compounded versions of it, where it is just the active ingredient semaglutide and tirzepatide. And we've been very successful, not only just helping our community, but trying to expand that help across the country. We're now a nationwide enterprise that can help anyone in all 50 states.
That's pretty great.
Yeah.
And so when you say that, these peptides are GLP-1s is what they're called.
Yes.
The two big names that you said that people don't ever say, but they usually Ozempic or what's the other?
Mounjaro.
Mounjaro is the other one.
Those were the name brands.
Yes. So those are what most people, I think, lay people, I would say, kind of would call them.
Absolutely.
And that, some people don't even realize that they are peptides. Because they are peptides.
The actual name, GLP, is glucagon-like peptide.
Like peptide.
That's what it stands for.
Gotcha. So, that's interesting because I know some people will be talking about this and they will have no idea what we're talking about. So I wanted to make sure we differentiated that, or that we're saying the same thing, that those things are the weight loss drug that a lot of people are using, and they're using it as injections right now. That's how it usually comes.
Yes.
Right?
So, there's always advances in science, and it is in an injection form where you inject a small insulin needle into your torso or into the back of your arm or into your thigh. Now with advances in medicine, they also have capsules that you can take if you don't like injections. And then they also have sublingual drops that you can take.
Didn't know that.
Yeah.
Good job. I didn't realize that. And so tell me the difference, too. There's also some stuff you add to your medication, or to your peptides, I should say, which is what? The NAD, which is a big deal, too, right now. You can give me a little bit on that. And then the glutathione.
So the two biggest names in peptides right now that's kind of the hot trend are NAD+, or NAD+, and glutathione. So when we talk about these things, NAD is really a coenzyme. It's not really a peptide, but it is something that helps with energy, with boosting your metabolism. It's kind of called the fountain of youth because it is a cell regenerative coenzyme that really aids the body. And then glutathione is very similar, where it is definitely a cell regenerative. It is a antioxidant, so it helps the liver get rid of toxins out of your body.
They both sound good. I think I want both of them.
Absolutely.
Can I put all of it in one thing and get it? It's like magic.
Sometimes you can mix things together, but you got to watch how much of the concentration you're mixing. So a lot of times it's really that you just do different peptides and you take more than one.
That's interesting. Definitely. Tell me about any big success stories, testimonies that you have from some of the people that have been on these.
Yeah, so we have helped a few thousand people now, and we have many success stories. I can tell you we've probably only had a handful, maybe 5 people, where one of the GLP injections did not work on them, and they still didn't lose weight. But for the majority of our patients, they've reached their goals and they get put on maintenance. What we try to do is make sure that you're not on this for life. We want to make sure that you get to where your goal is. And once you reach that goal, how do you get off of it and maintain that weight loss still? So one of the things that we're going to really talk about in a minute is a new company that just came out where we are going to transition people off the actual injection and put them on a peptide that can still aid in that weight loss once they hit that goal and let them maintain.
For the maintain, yeah.
Absolutely.
So it is always scary, I think, when you lose weight, and then how do you maintain? You can't. You have to change your habits, I feel like, too.
You definitely.
Because this is a good place where you can change them, but then you can't just go back to eating burgers and not exercising and think that you're going to just keep it off.
Absolutely. And, what we try and strive for is those cheat days per se,
Yeah.
where you can definitely still
Thankfully.
enjoy food. I mean,
Yeah.
we're in Louisiana, right?
I know.
So we're the food capital of the world here. So
Definitely.
we want to make sure that while you are more disciplined once you get off of it, that you do still have that, I call it a cheat day, but really it's a success day. So
Yeah.
you want to celebrate your success, and you want to be able to really enjoy the food that you're eating now.
That's a good way to put it. Definitely. I like that, success day instead of a cheat
Right,
day. I
right.
like that much better. So I know people are probably thinking, like, why a dentist is talking to you about weight loss and all those things and how they're related. But I do feel like they're definitely related, because the mouth is, part of our body. We have as a whole, is connected to everything. It's actually the place everything goes in, and systemically goes
Through your
all
body.
the way through the whole body, through the whole bloodstream and the whole system. So anything that goes in is going to affect everything, and it has to go in through I say it has to go in through our mouth, but we have injections, so
have
not
injections.
exactly that way. But yes, we still get affected. So there's many benefits for the oral cavity, the mouth, to have the benefits of these stronger, peptides, the synthetic peptides. I think there's a lot of related. I do feel like too, the medical teams they're a little like they don't have as much access to trying to do like a big holistic way of helping people. They kind of can see one thing and then they have to move on to the other, which is kind of sad, but it's kind of the place that they're in. And so I feel privileged to be able to have my own practice, and I can, even though I'm doing dentistry and I'm focusing on dentistry, I see so much when I open their mouth. There's so many signs of things, or just meeting them. I get their medical history, all the things that they see, the diabetes, the heart conditions, all that stuff.
Everything's connected. And really the GLP-1s, we have plenty of patients that come in from their cardiovascular surgeons that, it helps with cardiovascular disease.
Yes.
It helps with fatty liver disease. So it's a lot of different things, not just weight loss. You know, that the end result sometimes is weight loss. And, we live in a society that vanity is definitely top of mind, but longevity is really, I think, where people are starting to focus, and they want to make sure that they're around for their kids and their grandkids and live a long, healthy life.
Yes, I think that is definitely something people are starting to look at. Dementia and Alzheimer's, all those are coming so much quicker. We're having so many people have heart attacks so much earlier in life, like 30s and 40s, even pass away 30s and 40s. I don't know if it's because I'm now in my 50s that I start thinking that everybody younger is what's happening here, or is it really that they're a lot younger? So that is definitely part of why I wanted to start this wellness business and incorporate some of this GLP-1 peptides along with the other business that you're talking about that we're going to add in, because it helps people to live a longer life, but also a more productive, active life too. So, I mean, we can live long, but nobody wants to live long with dementia.
Right.
I'd rather live long and
know what you're doing.
And know what I'm doing and dancing and having a great time.
Right.
So that's kind of the way I definitely would like to be. I did look up, there were some advantages of the GLP-1 to dental specifically. I mean, it's people in general, but with the dentistry, there's of course the eating, you eat less. So, and you're not as hungry. You don't have the talk, the food talk in your head. The food noise.
Food noise goes away. It is a hormone. It connects to a hormone in your brain.
Yeah.
That actually prevents
food noise.
Food noise. No cravings anymore. And when we say cravings, it could be any type of craving. So not just food cravings. We actually have a few patients right now that are doing it just for addiction, whether that's alcohol addiction or drug addiction. And it is in clinical studies trying to see how it can prevent addiction.
Yeah, I love that idea for sure, to get to some of the treatment centers and give them something to help instead of just having to do it cold turkey, and then reverting back. If you have something you can kind of clutch to. Unfortunately, one addiction for another sometimes that they say, but this is a much better one to have than any of the other ones. So I know most of their family members would say the same thing probably.